Hey guys, welcome back. Another session of just the morning of me getting ready. I'm just prepping some patients. But lately I've been scrolling a lot on Instagram, trying to learn new techniques, see what other providers are doing out there, what new treatments I may not be experiencing or trying here at the practice. And a lot of what I'm seeing is not necessarily educating the patient. Well, let me take that back. They're not educating the patient, but what a lot of the education is based on fear. How much fear can I put into the patient so they don't pick another provider, so they don't pick this treatment, or they try to sell them on a specific treatment that only they provide. One of the treatments right now is one I ran across was RF microneedling, and there wasn't any specifics, so it didn't talk about the machinery, didn't talk about providers, but what it did mention was don't do RF microneedling because it will destroy your fat. And that was just the rant for a good, a couple minutes. And I want to go into the comments and see what people were posting. Most of it was, I agree with you, from providers, from patients, stating that when I had RF microneedling done, it made me look worse because it destroyed my fat. It gave me more laxity because it destroyed my fat. So the takeaway from this was putting in so much fear into patients, and I guess even providers, since providers are responding that don't do RF microneedling. And I'm okay with that because that was their way of educating people. Hey, don't do this specific treatment. That's fine. But if you don't do that specific treatment, what other options do I have? If you just instill fear in everyone, that's all of medicine, all of aesthetics. And we'll talk about what I mean by that. I can give an educated response in regards to why I don't do this treatment, but if I don't do this treatment, then I'm taking away what you're trying to improve. Now, can I give you a reasonable option that fits within your values and what you feel is correct for you, while also limiting or lessening the potential side effects and the damages that the treatments I want to use? So if the blanket statement is do not do RF microneedling because it will destroy your fat, I think it's doing a disservice. Because what if I do want to destroy fat? What if a patient came in and said, hey, I need to get rid of this gel? Well, I do want to destroy that fat area. What if they come in with submental fat? Well, I want to use RF microneedling to destroy that fat. So if the main fear factor is don't ever do this treatment because it destroys fat, well, what if my rationale is to destroy fat? I don't personally do lasers anymore. I stopped doing lasers when I left the practice, a different practice over a year ago, and we did all the lasers there. And RF microneedling probably became my number one laser. And I just say laser as a bulk general term for any devices, but RF isn't a laser and microneedling isn't a laser. But let's just say, for simplistic terms, devices. So lasers for devices. A laser is dumb. A laser only does what the provider inputs, meaning the settings, the depth, the heat, the energy. So if the provider sets up the laser wrong, if the provider does the treatment in a wrong way, then you will get wrong results. It's not necessarily the device's fault, it's the inputs. Meaning, if you are a ultra fit, low body fat, but you have laxity in your face, then you don't have a lot of volume. So what's going to happen? If I crank up that energy, if I increase the depth, and I blast your face with RF microneedling because you told me you want to lift and texture reduction, well, what's going to happen with those high settings and those deeper depths? I'm going to reduce even more fat that you don't already have because you're so fit, you're so slender. The treatment that you get from a device is directly correlated to the person doing the treatment and how they set up the device. So the setup is one part, but now let's look at a total picture for a patient. Most patients, as you age, you'll get hollow in certain places. Hollow, hollow, hollow. So imagine getting more gaunt, being more sucked up, and hollow here causing laxity. If I use the same energy as I do all the places where I'm trying to reduce volume, as the same place you have less volume, and I'm using all the same settings, then in the place where I don't want to decrease even more volume, I'm just blasting away your fat. So rather than me instilling fear into you and saying, do not ever do this device because this is going to be the result of it, well, I'm taking away my ability to reduce your textures, reduce your coloration, and potentially give you some lifting while reducing the fat if you want it. Why did I love RF microneedling? Because it gave me a good balance between laser results with less downtime. That's why I enjoyed it. Now the other part of this, and you'll hear this online all the time, patients will tell me this, RF microneedling hurts like crazy. And just like when patients come in and tell me PDO threads hurt like crazy, I absolutely love hearing that. Because it's my job to show you it doesn't have to hurt. That quote of beauty is pain, ridiculous. Beauty is not pain. You do not have to go through pain. I've mentioned this over and over and over. Doesn't matter how good the results are. If it hurts you, likely you'll never do it again. The pain isn't worth it. Pain isn't worth the gain. RF microneedling, PDO threads, fillers, if I don't do it correctly, if I don't numb you correctly, it's gonna hurt like crazy. Basically, RF microneedling is I'm electrocuting you for an hour and a half. That's essentially what's happening. So you can imagine, if you've ever done RF microneedling before, in the beginning, you're like, oh, easy, no problem, no problem. But once it strikes certain areas that are high density of nerves, you'll see your shoulder will start twitching, your neck will start twitching, your whole arm will shake. You're basically being electrocuted. When I do certain treatments, whole therapy, don't do it anymore, no devices. RF microneedling, don't do it anymore, no devices. Or even PDO threads. There's a certain way I numb a patient where they feel absolutely nothing. And at some certain point, not with my threads because it goes so quickly, but with lasers where it's a longer treatment, if you start feeling pain, do I just tell you to bear down? Do I tell you just use this ice pack to distract you? No, I stop, I reevaluate, and likely I'm gonna numb you even further to make you comfortable. Because if you're not comfortable, this whole process is just dragging out, and you'll never come see me again. So fear is not a motivating tool for someone. I want to educate someone on what is the proper ways to give you treatment that falls within your values. If you came in and you wanted RF microneedling, but you had all these fears, let me address them for you. Or the flip side, you come in, you have pores, you have fine line, you have jowling, you have some mental fat, and I recommended RF microneedling, and then you told me, hey, I read all this stuff online. There was this provider here and everyone was commenting underneath that absolutely under no condition should you do RF microneedling. Can I describe the treatment well enough? Do I have before and after pictures? And the way I educate you, does it make sense to you? If it doesn't, we'll pick something else. But I'm not gonna put so much fear into you that I wanna take away your ability to get a good treatment. I wanna use a very, very good example of this. PDO threads is one of the biggest fears that people try to put out there online. You'll see it. For every surgeon, nurse practitioner, provider, and nationally trained, nationally recognized that loves PDO threads, there will be another subset of just as well-known people, surgeons, nurse practitioners, PAs, providers, that will say, absolutely not. Under no conditions will I do PDO threads. It will cause scarring, it will cause lumps and bumps, it's painful, you can't do facelifts after it. You'll hear everything. So who's right? The national trainer, the board certified plastic surgeon, myself, who all love PDO threads, or do you listen to the board certified surgeon, another nurse practitioner, another provider who absolutely hates PDO threads? If you put fear into someone, if you absolutely hate a treatment, the second part of what I want to hear is, then what are my alternatives? That is medicine. The last example I'll give to you is this patient who always comes to me for PDO threads. However, this is her caveat. She says, I will not do the lifting threads. I've heard so much that it gives you scar tissue, it destroys your fat, and there's so many complications with it. So we've never done lifting threads. We've always just done tiny little mint monos, tiny little PDO smooths to help tighten and stimulate collagen throughout. Finally, after 3 years of seeing me, last week when I saw her, I said, hey, I have a potential solution for you. I have these tiny threads that are similar in size to the threads that you've always done, but now they have a small lifting capacity to it. She's like, say more. I said, we can put them in the same places we've done before, but instead of just trying to stimulate collagen over time, I want to give you an actual physical lift. She's like, I still don't want to put any big threads on the front of my face and neck because of the things I've heard and the things we all just mentioned. So instead of me forcing her hand, trying to convince her that this is the best treatment for her, I can educate her, but at the end of the day, it's her option, it's her face. So I compromised. I said, hey, what if we do this? What if I place them behind your hairline? What if I gave you a ponytail lift? One, you get the lifting that you've always wanted. And two, we avoid all this frontal area of your face. She's like, let's do it. And that's how I go about my treatments. If you have a fear of something, I'm not going to try to convince you otherwise. I can give you options, I can give you solutions, and we'll come up with a game plan together. So when you scroll through Instagram, when you scroll through TikTok, when you scroll through YouTube, you'll see all this fear mongering. But ask yourself, if you're not going to give me RF microneedling, if you're not going to give me fillers because it causes lumps and it lasts forever and it migrates, if you're not going to give me Botox because it will cause ptosis, it will drop my eyebrows, I don't want to feel frozen. If you hear about don't do PDO threads because you'll never be able to do surgery, it will give you scar tissues, well, what do we have left for aesthetics? Every single treatment has side effects. Every single treatment has potential complications. Can your provider or the provider you choose mitigate all those issues? We can never get to 0%, but there will be a provider out there who's untrained and give you all the complications in the world. Or for myself, I will try to mitigate that all the way down to 0% the best I can. So I think that's why we're going to speak about this morning is when you doom scroll and you see all that stuff about fear, what's the intention behind it? And finally, if they're not going to offer those treatments for you, do they give you an alternative? And does the alternative fit within your values, get you to where you want to be, and make you feel comfortable? So that's my little morning conversation as I set up this morning. I'll talk to you guys soon. Bye.